Prescription for Addiction, a Failed Experiment, your second psychiatric consultation. Today, we will talk about the practice of medicine in regards to the use of opiates. For example, generally prior to 2000, physicians avoided prescribing opiates for pain except for a few days after surgery or injury while a serious wound healed. Third parties intervened with the assertion that patients were suffering from chronic pain and physicians lacked compassion and were not prescribing enough opiates to provide relief from pain. In 2000, the Joint Commission decided to issue rules to physicians about the evaluation and treatment of pain. The Joint Commission issued pain management standards, making pain the fifth vital sign. Since the year 2000, there has been a surge in physician prescriptions in opiates, opiate addiction, and deaths from opiate overdose. The Joint Commission also decided to rate physicians and healthcare facilities on patient satisfaction surveys. Patients in pain are not satisfied, and this created additional pressure on physicians to prescribe opiates for pain. The Joint Commission is only partially to blame for this situation. The surge in opiate prescriptions, addiction, and death has been fueled by marketing strategies in the pharmaceutical industry. The misinformation in marketing in business is ubiquitous. Examination of lawsuits involving the sugar industry, the tobacco industry, the asbestos industry, the chemical industry, and the pharmaceutical industry reveals the depth and breadth of irresponsibility in business and how it corrupts science, law, and education on many levels. The first lawsuit against a pharmaceutical company for marketing opiates was against Johnson & Johnson. The fact finder determined that Johnson & Johnson had intentionally played down the dangers and oversold the benefits of opioids, and ordered Johnson & Johnson to pay the state $572 million. Purdue Pharma was facing charges of misleading marketing and practices and misrepresentation regarding OxyContin. To avoid the trial, Purdue Pharma agreed to pay Oklahoma $270 million. In a related case, Purdue Pharma offered about $12 billion in August of 2019. Purdue Pharma and the Sackler family were facing allegations that they were responsible for starting and sustaining the opioid crisis. The pharmaceutical industry has a long history of playing down the dangers and overselling the benefits of medications. Thalidomide is an early example. The pharmaceutical industry pressured the FDA to approve thalidomide, and FDA pharmacologist Francis Oldham Kelsey refused repeatedly despite heavy political pressure by the pharmaceutical industry. John F. Kennedy presented the President's Award for Distinguished Federal Civilian Service to Francis Oldham Kelsey in 1962. Francis Oldham Kelsey saved thousands of children from birth defects, including phocomelia, by refusing to grant FDA approval to thalidomide. Healthcare providers have been a part of the feeding frenzy. Doctors across the country are being sent to prison for prescribing opiates. Physicians and healthcare facilities have a long track record of bad behaviors. In 1994, the National Medical Enterprises paid $375 million in fines and penalties and reportedly sold psychiatric hospitals to Charter Medical Corporation. NME owned Psychiatric Institutes of America, PIA. A former regional vice president of Psychiatric Institutes of America, a division of NME, pleaded guilty to charges involving kickbacks to doctors in return for the referral of patients and making false statements to Medicare. He gave a list of psychiatrists and psychologists who received kickbacks for admitting their patients to the PIA psychiatric hospitals. Those psychiatrists and psychologists were required to pay restitution and at least one went to prison. Restitution is a $5,000 fine for each fraudulent billing, in addition to a triple payback for each fraudulent billing. In the year 2002, the Hospital Corporation of America, HCA, paid the largest fraud settlement in the United States history, over $2 billion in restitution, fines, and penalties. In regard to the chronic treatment of pain, anxiety, and insomnia with addicting medications, the future is rather grim for the practitioner. Take, for example, Ambien. Ambien loses efficacy after 14 days, but 77% of patients continue using Ambien after 14 days. What is the end of the road for treatment of chronic pain, chronic anxiety, and chronic insomnia with addictive medications? You can read about Michael Jackson and his physician, Conrad Murray. Michael Jackson was paying his physician $150,000 a month to give him propofol at night. Michael Jackson died with a combination of benzodiazepines and propofol, and his doctor went to prison. Let me squeeze the worm a little more with letters I might write if I was working for the state medical board, the health insurance company, the plaintiff attorney, the prosecuting attorney, the malpractice insurance company. That's it for today. Tomorrow I'll read the letters, which have a sarcastic undertone and too much reality for most physicians to feel comfortable with. Thank you for your time and your kindness. Have a great day.